Hi, Dr. Brian Kaufman, a retired family doctor and CLL patient myself, and also the co-founder, executive vice president, and chief medical officer in the nonprofit CLL Society. And I'm presenting some of the important and interesting research that was presented at the American Society of Clinical Oncology, or ASCO, at their annual meeting in 2022. Today we're going to talk about a phase 1b/2 study of Lisaftoclax, a novel BCL-2 inhibitor in patients with relapsed refractory chronic lymphocytic leukemia or small lymphocytic lymphoma, relapsed refractory CLL/SLL. What follows is a patient-friendly summary of the research. And I always start with the bottom line. Lisaftoclax is an experimental BCL-2 inhibitor, quite similar to venetoclax, but it has a faster and more convenient ramp-up dosing. Who presented the research and where was it done? Yuanyang Li from Jiangsu Province Hospital in Nanjing, China, and others presented the results at the American Society of Clinical Oncology's annual meeting in Chicago in 2022. Let me give you the background. CLL cells are very efficient at evading programmed death. The medical term for that is apoptosis. And they do this by expressing a protein called BCL-2. It's actually a school of proteins. Venetoclax blocks that overexpression and leads to rapid cell death. It's the only approved BCL-2 inhibitor, but it requires a slow ramp up of the dose to prevent the risk of potentially dangerous tumor lysis syndrome, or TLS. And that's where the cancer cells are killed so quickly that the body can't handle them, leading to excessive levels of things like potassium and uric acid, causing kidney damage, and in the worst cases, death from the heart not being able to beat properly. Another issue is that a few patients have CLL that is moving so fast that the ramp up, which takes weeks, may be too slow to catch up with their disease. And for all patients, the lengthy ramp up and the associated need for frequent blood tests is an inconvenience. Venetoclax has also been associated with low blood counts, especially the infection-fighting neutrophils, but also other cells, including red cells, all the other white cells, and platelets. Lisaftoclax is a novel oral BCL-2 inhibitor that is being studied to see if it's safe and to use in a much quicker daily versus weekly ramp-up. Let's review the methods and who participated. As is the case of all early phase open-label studies, and this is a 1B, so that a phase 1B/2 trial, its purpose was to assess safety and to better understand and define the best dose of the medication. It was not designed to look at how well the medicine works. What were the results? As in most early studies, the numbers were small. 45 patients were enrolled. 42 patients experienced some type of adverse event, some type of side effect, including low neutrophils and 55.6%, anemia or low red blood cells and 42.2%, low total white count and 40%, low platelets and about 38%, high uric acid, which comes from the cells breaking down quickly, in 31%, and diarrhea in 20%. 28 or 62.2% patients had more serious side effects. And although, as I said, it was not designed to study response, 41 of the patients of the 45 were evaluated. There was one complete response, and 27 achieved partial remission for an objective overall response rate of an impressive 68.29%. The go-forward dose of Lisaftoclax as a single drug therapy was determined in this trial to be 600 milligrams. So, what can we say in conclusions and comments? It's much too early to predict how Lisaftoclax will fit in to the treatment paradigm for CLL/SLL, but right now it looks very similar to venetoclax, with the possible significant advantage of a faster ramp up to the treatment dose. Whether it is more or less safe or more or less effective than venetoclax is unknowable at this point. Even if it turns out to be a me-too BCL-2 inhibitor, that would be a significant benefit for those with CLL, SLL, as it would offer another therapy choice. In the way of links and resources, we give a link to the actual abstract where you can find more details in terms of the statistics. The actual title was a Phase 1b/2 study of Lisaftoclax, a novel BCL-2 inhibitor in patients with relapsed refractory chronic lymphocytic leukemia or small lymphocytic lymphoma. Thanks for listening. Stay strong. We are all in this together.